Hello, my name is Jacob Thompson. This is for Kinesiology 337 lab, and today we're going to see about elbow dislocations. So how you get an elbow dislocation is if you fall on an outstretched hand with your elbow extended, or a severe twist with an elbow flexion. You can also have it get dislocated if your radius or ulna is popped out of place. So we're going to go over some bony landmarks for elbow dislocation. So the first one is going to be the humerus of the arm. So it's this full length right here. And then we have the lateral epicondyle. It's a little bump on your elbow right here. And then on the opposite side, we have the medial epicondyle right there. It's another bump on the other side. Okay. So 3 soft tissue landmarks that will identify with possible injury with elbow dislocation. We have the biceps brachii, which does elbow flexion. The long head of the triceps, which is elbow extension, which is characterized right here. And then we have the extensor muscles of the hands, which runs along the top of the forearm right here. Okay. So some acute injury treatment we can do for elbow dislocation is using a sling. Go ahead. Flip it around. And this will be for simple dislocations, and usually stick around for 1 to 3 weeks inside of these. Another thing we can do is called reduction. So take that off. Is putting the elbow back into place. So what people will do is we'll have physicians hold right here and another one right here, and they'll pull the wrist towards myself, and it'll put the elbow back into place. So for 2 long-term injury treatments we can do is one of them is surgery if you have a fractured or damaged ligaments inside the elbow. And then another long-term solution we can do is physical therapy with the use of bands. So what she's going to do is start with elbow extension, and as you work your way up towards elbow flexion, the band will provide resistance to the biceps, which help you with that elbow flexion. So 3 bony landmarks for the shoulders we can identify. One of them is being the humerus, again runs the full length of the arm. The next one is the clavicle, which runs into the shoulder joint. And the third one is the greater tuberosity, identified right here. It's that protrusion identified by that black dot. So 3 bony landmarks of the wrist we can identify. One of them being the radius, which rotates on top of the ulna. The second one's going to be the ulna, right here. The third one, which we identified in class as the anatomical snuff box, inside of that we can feel and palpate for the scaphoid bone inside the hand.